Now, Nigeria joins the rest of the world to celebrate this year's World Heart Day. Now, every 29th of September is set aside to raise awareness about the rising concerns of heart health and cardiovascular illnesses. Heart disease and stroke are the world's leading causes of death, claiming 18.6 million lives each year. Now, this year's theme is Use Heart for Every Heart. And joining us in the studio for more on best ways to manage a healthy heart is Dr. Augustine Olugbemi. He is a cardiothoracic and vascular surgeon. It's a pleasure to have you on the show.
Thank you. It's a pleasure to be here.
Of course. So, first of all, happy World Heart Day 2022.
Thank you very much.
Yeah, so let's begin with this very scary statistics that we have. You know, it says in Nigeria, you know, we have about 61,374,000 deaths, you know, that is caused by cardiovascular heart diseases, which is about 4.14% of the total deaths in the country. You know, so this is like 100.91, you know, per 100,000 of population, and that ranks Nigeria 107 in the world. Very scary. Now, what is the implication of this data, you know, as it relates to heart diseases in Nigeria?
First of all, I must say that this data is probably underestimated. Okay, now the implication of this is that Nigerians are not paying attention to their health, and especially the heart, because there are a lot of stressors in the environment. So more people are not giving attention to the heart, because the heart is the engine room of the body, of the human. So when the heart packs up, the individual packs up. So this statistic just tells us that, look, we need to wake up, we need to give more attention to our hearts.
Indeed, I quite agree that we need to pay attention to our hearts. But, you know, the thing is, some people might not even know that, they might not be aware of the fact that they have this cardiovascular diseases. But in the, you know, point where they know, you know, what can be done, you know, to reduce the risk, you know, of having this, or, you know, preventing this disease?
Okay, that's one of the aim and objective of celebrating the World Heart Day, to educate people and enlighten people about their heart conditions and the need to give attention to their heart. And not just knowing these things, but doing these things, because it's in doing these things that you get the benefits. So, first of all, is to prevent these heart diseases. That is the best way to go. And how do you prevent it? Number one, exercise. Regular exercise is very, very crucial. Avoiding a sedentary lifestyle. You have people that leave their houses, go to their offices, sit in one place for 8 hours. That is sedentary lifestyle. That you go to work doesn't mean you're not sedentary. So, after 1 hour walk, take a walk. Some people that maybe walk in the 6th or 7th floor decide to take the staircase rather than take the lift. So apart from regular exercises, take a walk around your estate or do some aerobics, okay? And then healthy diets, more of cooked food rather than processed food. If you smoke, smoking is one of the burdens you need to drop. Smoking, you need to stop smoking. You need to reduce or stop alcohol intake. And if you are obese or overweight, it's not a sign of good living. A lot of people say when you're getting bigger, oh, you're chopping up. No. You are killing yourself. So you need to drop your weight, and that's one of the benefits of exercise. But more importantly is, if you are above 35, 40, it's important that you do regular checkups. Okay, at least once in a year. Certain things you need to check up with regards to your heart. Okay, when you go to the hospital, just tell anyone to do a comprehensive check. And most of these things can be picked. When you get to the hospital, the various tests you can do from what you call vital signs. Your blood pressure, your heart rate. Is the heart rate regular? As simple as that can give an indication. ECG, what you call electrocardiogram, it measures or depicts the electrical activities of the heart. That can be done virtually in every hospital. Echocardiogram, echocardiogram looks at the structural component of the heart, the valves, the chambers, these can be picked. If there's any problem, it can be picked up early before the symptoms of heart failure begin to set in.
To manifest. So I'm glad you're listing all of these things, but still, let's consider the high cost of living. Consider how the economy is currently in the country, and access to all of these machines that would be able to make these checks. So if you have access to the machines, the next thing is the ability to pay. So how do we cross this bridge?
Yes, it's a big problem for us, especially when it relates to cardiac problems or cardiac diseases, because taking care of cardiac disease is quite expensive, okay? But first, like I said, if you do regular checkups, you can catch these diseases early.
So the thing is the checkups are also so expensive?
No, they're not very expensive.
What's the cost of the checkups?
For instance, if you do regular blood pressure check, pulse rate check, ECG shouldn't be more than 5,000–10,000. You walk into any hospital, you can have this done. As a matter of fact, you have mobile things you can use.
Don't forget the minimum wage is 18,000 naira.
Well, another thing is what I must emphasize here is the need for insurance. Okay, if you work in any establishment,
30,000 naira, my bad.
Yeah, insurance, National Health Insurance Scheme is available. Yeah. Go and register. Go and register. There are other insurance schemes, okay, that you can register with, that can protect you, that can pay for. They may not be able to pay everything, but they can pay for most of these basic things. And then I also want to say that for patients, for instance, that have heart problems, like they need to change their valves, they need to do what we call coronary artery bypass graft, it's quite expensive, whether in the government hospital or in the private hospital. Individuals that have money can actually approach hospitals and say, look, I want to be part of saving lives. For instance, we have a lot of patients right now in Evercare with heart problems. They need to change a valve or something, we need to do something about the heart, but they can't pay. So if we have individuals in the society that says, okay, we want to be part of this, saving lives. It's one of the awareness why we have World Health Day, creating this awareness that, look, we have patients that have need, but they can't afford it. You can call the hospital, say, oh, look, I want to sponsor I want to sponsor 5 patients. I want to sponsor 10 patients. It may be churches, maybe mosques, maybe organizations. The hospitals are there. Approach us, and we can save a lot of lives.
But has that been happening? I mean, say maybe in the previous years?
No. Well, there are some, I know of some hospitals that has been doing this drive, and it's actually been working for them.
Well, I hope that moving forward, this would work not only for Nigeria, but in Africa as well as in the world, where we would have philanthropists, also adding their voices to see that those who don't have the ability, the financial ability to pay for such checks and even treatment, are helped. But I have to say thank you for joining us today on the show, Dr. Olugbemi.
Thank you very much.
It's a pleasure to always have you. Again, happy World Heart Day.